Hi everyone, and welcome to TS Fibro. I want to thank everyone for joining me and watching my videos. I hope they're informative and you enjoy them and get some information out of them. If you haven't already, please subscribe. If you like the video, hit that thumbs up. And if you want to be notified of when I put out my next video, click on that bell. Today's video is on TMJ and fibromyalgia and chronic fatigue syndrome. Millions of people are thought to be ill with temporomandibular joint disorder, which is TMJ, a condition that is frequently misdiagnosed or goes undiagnosed because many of its most broadly reported symptoms, severe headaches, facial pain, neck and shoulder uneasiness, jaw popping or sticking, either seem indistinct or are connected with other medical conditions. TMJ joint disorder causes jaw pain, and it is more frequent in people with fibromyalgia and chronic fatigue syndrome than it is in the general healthy people. In the United States, more than 10 million people are believed to be affected by the jaw pain TMJ, and women are more affected than in men by this disorder. What is TMJ? The temporomandibular joint attaches your jaw to your skull. They are stabilized and supported by muscles and ligaments that function to open and close your mouth. Pain or tenderness in or around the joints is referred to as TMJ disorder. The causes that led to this disorder are not still unknown, but most experts have the same opinion that jaw injury can be the cause. Other related conditions contain nervousness, stress, and rheumatoid arthritis. The pain can vary from mild to severe, and treatment usually depends on the severity. There are two types of disorders of the temporomandibular joint. Number 1, joint TMJ. It is caused by injury to the cartilage or ligaments of the joint. Patients with joint TMJ may go through from bursting and clicking of the jaw joint and the fail to open the mouth very broad. According to the American Dental Association, arthritis can cause TMJ injury or displacement. Number 2, muscular TMJ. This is more possible to influence people living with fibromyalgia. It affects the muscle used to chew food and move the face, neck, and shoulders. Sleep deficiency, a main constituent of fibromyalgia, stress, and muscular injury may cause muscular TMJ. The TMJ is located on both sides of the head. This joint, along with the lower jaw and jaw muscles, make it possible to open and close the mouth. Patients with tooth ailment problems may need dental intervention. Missing teeth, teeth which are not placed in the correct place, dentures that do not fit properly, they can be the cause of TMJ. Orthodontic braces may be required to fix this condition. It is hurtful, but most indemnity companies do not identify the benefits of teeth alignments or massage for the treatment of the symptoms of TMJ. Your doctor and dentist will have to synchronize a plan and speak with the insurance company about the requirement of therapy. The overlap between TMJ, fibromyalgia, and chronic fatigue. We do not know up till now why people with fibromyalgia and chronic fatigue syndrome come out to be more liable to this condition. When TMJ occurs first, it is possible that the pain could add to the development of central sensitization, which is believed to be a basic constituent of fibromyalgia and chronic fatigue syndrome. When the other conditions are diagnosed first, TMJ may be related to sloppy connective tissues thought to be related with them. A rising explanation is that all of these conditions may fall beneath the umbrella termed central sensitivity syndromes. In view of the fact that people with fibromyalgia and chronic fatigue syndrome feel pain more intensely than others, they may endure more from hurting conditions. Getting diagnosed. TMJ disorders are most often diagnosed and treated by dentists. There is no solitary, broadly acknowledged test. Your dentist may examine the jaw for tenderness, popping, clicking, and difficulty opening and closing your mouth. Your dentist may also see how your teeth fit jointly by taking an x-ray and a cast of your mouth. If TMJ is not caught early enough, as a result of the clenching or grinding, the jaw joint can become injured or dislocated, resulting in clicking, humming, and popping noises which are heard in the ears. Chronic teeth grinding can result in a fracturing, loosening, or loss of teeth. In intense cases, the chronic grinding may wear the teeth down to stubs. It is an excellent idea to ask your regular doctor to rule out other causes of facial pain, such as sinus headaches or earaches. Also, if you have myofascial pain syndrome, which is common in people with fibromyalgia, trigger points on the sternocleidomastoid muscles in the front of the neck can cause jaw pain. It is unidentified whether these kinds of trigger points actually cause TMJ or just cause comparable symptoms. Fibromyalgia and TMJ pain. What's the connection? It is predicted that about 90% of people living with fibromyalgia bear some type of jaw or facial pain. However, that does not mean that all of those will have TMJ. Some people believe that you have to experience absolute jaw lock before you are diagnosed with TMJ, but that is not the case. The incidence of other related symptoms when all other possible causes have been ruled out is sufficient for the diagnosis in some cases. TMJ and the related facial jaw pain can be an expansion of fibromyalgia when a diagnosis for fibromyalgia is already in place. Others will give a secondary diagnosis of TMJ. When the pain does not allow you to sleep at ease, confines range of movement for your head, and affects proper chewing, this can influence the value of life. Symptoms. Other than headaches, the symptoms are somewhat distinctive from symptoms of fibromyalgia and chronic fatigue syndrome. They consist of jaw pain, uneasiness or obscurity in chewing, painful clicking in the jaw, not easy to open or close, and teeth do not fit properly. Treatments. In some cases, TMJ symptoms vanish away without any treatment. If you are having unrelenting symptoms, your doctor may advise either traditional treatments or a more extreme approach. Traditional treatment include anxiety reduction, no gum chewing, why yawning should not be done, ice packs, anti-inflammatory drugs such as Advil or Motrin. More extreme treatments include orthodontics or surgery. These extreme treatments are notorious, so you may want to get a second opinion before allowing them. Long-term TMJ relief. The research leads to more questions. It also contributes to a more inclusive information based about the connection between TMJ, fibromyalgia, and other chronic pain conditions. Even though there is no treatment for fibromyalgia, there are medications accessible to help handle the pain. The news is good for those with TMJ disorder. There are a number of TMJ treatments accessible, counting oral appliances to clutch the jaw in a most favorable position and Botox cosmetic to relax the jaw muscles and alleviate nerve pain. The first step to discover long-term liberation from TMJ pain is to discuss with a well-informed neuromuscular dentist who will advise the finest selection for you based on cause and harshness of your state. TMJ treatment versus fibromyalgia chronic fatigue syndrome treatment. TMJ treatments do not normally hinder fibromyalgia or chronic fatigue syndrome treatments. On the other hand, those people with high temperature sensitivity may have a tough time tolerating ice packs or improving from surgery because of their other conditions. Also, some experts consider that many people with chronic fatigue syndrome are receptive to definite types of anesthesia, even though this has not been confirmed in clinical studies. Anytime you are taking medication for more than one condition, you should always talk with your doctor and pharmacist about likely drug interactions. Living with multiple conditions. The pain of TMJ can make your fibromyalgia or chronic fatigue syndrome more complicated to handle, making treatment especially important. Scientists from the National Institute of Health are carrying out a broad range of studies to better comprehend the pain procedure, as well as the facial pain of TMJ and what it has infrequent with disorders involving extensive muscle pain. The investigation could help us better appreciate TMJ and its connection to fibromyalgia and chronic fatigue syndrome, leading to better treatment for all of them. Thank you everyone for listening to the video. I hope everyone got something out of it. And if you haven't subscribed yet, please subscribe, hit that like button, and hit that notification bell so you'll be notified when I make my next video. Okay, everyone, I pray for a cure, and I pray you have a pain-free day. God bless everyone.